So that's our first line of defense at the border. Beyond border controls, our second line of defense is to identify and isolate the people with the virus, as well as all of the close contacts of the infected persons. We have a well-established contact tracing procedure which we put in place during SARS and have continued to fine-tune through emergency exercises and through experiences dealing with previous outbreaks like MERS and H1N1. As of 8 a.m. today, we have 18 confirmed cases of the virus, all with recent travel history in Hubei, as Minister Gan mentioned earlier. 16 are PRC nationals, mostly here on short-term passes, and the other 2 are Singaporeans who were among the 92 who came back recently from Wuhan after the city was locked down. Beyond the confirmed cases, we have tested a broader group of 240 suspect cases, all of whom are negative. And then there are another 43 suspect cases for which test results are pending. All of the outstanding suspect cases have been isolated. The close contacts of the confirmed cases are also now on quarantine. In addition, we have been contacting the recent travelers from Hubei who are presently in Singapore and putting those of higher risk on quarantine. As of last night, there are 524 persons under quarantine. 222 are in government quarantine facilities, and 302 are serving quarantine at home. Persons under quarantine are required to stay in their designated location at all times during the quarantine period. They cannot physically interact with others living in the same premise. For each case, we will assess whether to quarantine the person at the government quarantine facilities or to do so at the person's home. In cases where the home is found to be suitable by MOH, then home quarantine would apply. And we would use video calls, phone calls, and regular spot checks to ensure that they remain in their assigned quarantine location. These are protocols that we have all worked out through SARS and fine-tuned over the years, as I mentioned. Persons who do not have a suitable residence for quarantine would then be housed in the government quarantine facilities. And there are severe penalties for non-compliance of the quarantine order, including fines or jail. Besides quarantine for close contacts and high-risk groups, we have also taken precautionary measures for recent travelers from other parts of mainland China, outside of Hubei, as I mentioned just now. Our assessment is that they are of lower risk compared to those who were recently in Hubei. So for all such returning residents and long-term pass holders, we ask them to take a 14-day leave of absence from the date of their return. This is one way to reduce their exposure when they are back and thus reduce the risk of community spread in Singapore. Those on leave of absence are expected to remain in their residence as much as possible, minimize visitors, and maintain a record of persons they come into close contact with. They also need to minimize time spent in public places and contact with others, monitor their health and temperature daily, and avoid crowded places or social gatherings. So we have put out guidelines on what an LOA means, thus to ensure that anyone who's on a leave of absence knows what they are expected to do. They may resume normal duties or activities only after they have served their LOA if they remain well. We have put in place measures like the quarantine orders and the leave of absence to protect Singaporeans from the spread of the virus.